Okay, for my project, I decided to do working with autistic patients in the office. So what is autism? Autism is also known as autism spectrum disorder, refers to a range of conditions. They're characterized by challenges with things such as social skills. Um, they deal with like speech, nonverbal communication, repetitive behaviors, nonverbal communication, unique strengths and differences. There are different many types and spectrums of autism. The main ones, which would be autism disorder, which is known as the classic autism. This involves things such as language delays, social and communication challenges, unusual behaviors and interests. Pretty much when you think of autism, this is usually the main one, unless it's defined by the other two. The next most common one, which is the Asperger's syndrome. It is a little bit milder of symptoms compared to regular autism disorder. They may have some social and communication challenges. However, they normally do not have problems with language or intellect, like with their disabilities. So these are normally your people who, they're more of your standoffish people. They're going to be your patients that appear to be normal, but you will notice that they do have some little things about them. Then the last one I was going to talk about is pervasive development disorder, which is known as atypical autism. It will meet some of the Asperger's syndrome, but not all of them. May only show slight social or communication challenges, not very strongly enough to make it to where it would be Asperger's, but enough to know that there is some kind of disorder with patients. Usually, the patients that are autistic will be diagnosed when they're around 2 to 3 years of age. This is just because around this age is when you'll start noticing things such as the verbal, nonverbal communication. There are some things that can start when they're younger. Some of those signs and symptoms would be when they're around like the age of 1 year old. They would not be responsive to their name, or it takes them a while. They don't really show interest in objects. So say like an airplane is flying overhead, it really won't catch their interest. They won't like to play pretend. Most toddlers like to, have their imagination and like to pretend, but a child with autism won't. One of the biggest ones is the verbal communication skills. From personal experience, my brother, who is autistic, he did not actually start talking until he was almost 4 years old. He actually relied a lot on nonverbal communication, which he was taught sign language, and that's how, he would interact with us and tell us what he wanted, what he needed. In the United States, 1 in 59 children will be diagnosed with autism. Of these studies, 1 in 37 boys are going to be diagnosed as autistic or on some sort of spectrum, and 1 in 151 girls will be on the spectrum. Based on studies, it does find that males are more common to be diagnosed with autism or some kind of spectrum disorder of autism more frequently than females. So what to expect when working with these patients? One of the biggest things with autism patients is a lot of them are nonverbal. These can be things such as straying away from communication, not wanting to actually speak. They could know things such as sign language, pointing out objects. And then there are just some who are completely mute. Some of the only people they will trust to talk to will be like their caregivers, their guardians, people who take care of them, who are around them often, who have worked with them. Those are usually going to be the ones who they will be able to get to actually work with them. With the intellectual disability, that's just once again, it's something that certain patients who do have this, it's going to be very noticeable with them if they do have this disability. There are some medical and mental health issues that actually accompany autism. Some of those would be things like GI disorders, so gastrointestinal. Some patients with autism can also suffer from seizures. They will have problems with sleep disturbances. A lot of people who actually have autism will also have ADHD. And that's usually one of the big problems, especially when the patients are younger, because they will try to pass off as ADHD instead of autism. A lot of them will have things with like anxiety and phobias. A lot of them, like especially with kids, they'll just have like a lot of like social phobia, fears of going to new places, interacting with children or people. Also, there is just some things like with certain medical issues is a lot of the times because of the fact that they have like anxiety or the possible ADHD, it does get misdiagnosed as OCD. So what I wanted to do on the side of this was I wanted to put a couple of like the warning signs, kind of some things that people will know, just kind of some things that show, what you might see with a patient who is autistic, which I feel is important to know in a doctor's office because you might be getting a new patient who you actually don't know is autistic. So sometimes by knowing some of the warning signs, you can be able to kind of get the idea before they come into the exam room. So overcoming the barriers. One of the big things is speak to them in a way they'll understand. Now, depending on the age of the patient, if it's a child, obviously you're going to talk at, a level that they'll understand and feel comfortable with. As they're older, once again, even though they will have a disability, you never want to talk down to a patient. You might just want to really relate the way you communicate and interact with them as to how they respond to it. So if you see what you're doing gets a good response, then keep doing that. If you see there's a negative response, depending on what like their caregiver or that will tell them or tell you about it, chances are they might just not react very well, and you just have to kind of stay strong and not get frustrated as hard as it's going to be. You have to remember they don't necessarily ask for this kind of life, it just happens. Look for cues. There's definitely things that each person will differ from with autism, whether it's something they like, something they don't like, and what you just need to honestly do is just kind of pay attention to them and really see their likes, dislikes, what's working, what's not working. Discussing things with the patient's family or caregivers, this is extremely important because these are people who are normally with the patient almost 24/7. So by, finding out from them things that work, don't work, this will definitely make it easier for you, because this also ties into the next one with checking charts. You can also see maybe what has been documented or charted before, maybe by another medical assistant, by the doctor. If you're trying to do vitals, this is the way you have to do it. And then if it's a new patient, by talking with the family, you can actually put this in a chart. Therefore, if the patient returns, the next medical assistant or doctor will know how to work with them. And then definitely just researching disabilities and disorders. Any of us who are medical assistants know in the field we are going to deal with a lot of different patients with disabilities, disorders, different ethnic races, a bunch of different things. So by becoming better acquainted with knowing some of these things, especially more of the common things such as like autism, Asperger's, like, Down syndrome, things like that, by acquainting yourself with it, it'll make it a lot easier when it comes into the office, because then you already would know what you need to know as an MA, but now because you have advanced your learning, you're going to make it a better experience for not only yourself, but for them as well. The reason I picked this topic and why it is so important to me is this is kind of an old picture, but this is my little brother and my son. My brother is 7 years old. I have practically raised him since he was born. At 2.5 years old is when we started noticing that he was autistic. And I have gone to doctor's appointments with him, and I have seen sometimes just how the medical assistants or nurses will get frustrated because they don't always know right away that he's autistic. And pretty much what makes it hard is, they want to try to do their job the way they know how to do it, and they don't always accommodate very well. But yet when you go to places like his therapist, where they're working with patients with disabilities all day, it's such a much different experience. And I think because of having a family member that does have, a disability, it makes it a lot easier on me as an MA to go in knowing that this is something you will experience, you will work with, that it's going to be tough, it's going to be hard, but as long as you are willing to educate yourself and work on it, you will make yourself a better MA, and you will make yourself someone that patients and their families will remember. But these were the references I used. I did a little bit with the book, and then also I used Autism Speaks page. It was a really beneficial page. Definitely something I will be referring back to more, as I feel like it'll help me not only educate myself better, but others as well. But this was my project on the disabilities of students with mental disabilities or challenges we might face in the medical office.